All right, so I'll be talking about real-world endpoint management and the utilization in the real-world setting of this new technology. We've had this device for about 2 years now, and previous to this, I was actually using the Iridex micropulse laser since 2011. So we've actually had a head-to-head comparison of both devices, and towards the 2016, we actually switched over to endpoint management, and we're able to actually look at the differences that we see in this particular condition in treating conditions like central serous retinopathy, diabetic macular edema, and retinal vein occlusion. This the Pascal as an excellent laser. We've had, again, the ability to compare it head-to-head with the Iridex micropulse since 2011, and they really use it in these three indications and found that it's actually been beneficial. So we're going to do some real-world case discussion on its utilization. So, very briefly, subthreshold laser is no longer really in its infancy. We've been using it for a number of years. There are multiple manufacturers that do this, but do we do it well? And so I think, where we are with the Pascal and the endpoint management system is we have the ability to titrate this to the level that we need. So when we look right here, this image shows us that the 532 green laser versus 577 nanometer yellow laser, we actually get penetration through the retina without damaging the retina at all. And the purpose is to have uptake at the level of the RPE. So what we see is that, the degree of penetration obviously depends on the amount of melanin in the retina. And 577 actually is a little less deeper penetration, so we can focus it on the RPE versus actually causing damage. We get uptake from not only the RPE, but we also get it from the choriocapillaris and the choroid. And in conditions that are choroidal in nature, that's actually our point. Our point of titration is the area in the choroid. So we look at the area of absorption that happens. We're looking just for very focal absorption, particularly if we're trying to treat a CNVM or in CSR. You're looking just to treat the hot spots themselves. And from an efficiency standpoint, patients don't really see this laser. They don't have a burn or experience a burn in this process. Again, we're really using this technology to help stimulate tissue and stimulate the healing response within the retina. So on the far right of the screen here, we're going to see an example in a mouse model of what happens to the retina when a laser is delivered. And you'll start to see that the laser spot burn, this circular structure you're seeing form in front of you here, you're starting to see actually the heat shock proteins and the cellular response that starts to occur in response to a laser treatment. So, we definitely know on a cellular level that we are making changes to the biophysiology of the retina in a positive way. So, I was asked to put together some cases and how we use this in our practice, and obviously we have great anti-VEGF products at our disposal today and a variety of conditions that could lend themselves to endpoint management treatment. So this is a 52-year-old male with diabetic macular edema, pretty classic for our world of diabetes today. You can see a lot of cholesterol deposit there, a lot of blood and hemorrhage. And this patient's right eye, the vision is 20/200 and 20/80. I mean, he's significantly debilitated. He can't drive his car anymore. We have to take his license away. So significant lifestyle impact as a result of this condition. Again, we have great anti-VEGF drugs. He's had 10 injections, and if you look here, he's still got a lot of leakage on his fluorescein angiogram, a lot of bright white spots of dye leakage. And more importantly, you look at a Topcon Triton OCT here for the right and left eye. In spite of having 10 injections, he still has a lot of intraretinal fluid and subretinal fluid. And clearly, we're not doing a good enough job in this particular case. So what's our plan with this patient? I mean, we can either change anti-VEGF agents, we can try steroid. In the old days, we would pick up and use traditional laser photocoagulation. But the challenge is that laser photocoagulation from a traditional standpoint burns the retinal tissue. And we don't want to burn tissue. We want to save vision, stimulate the retina, and help a healing response take place. So after 10 injections, this is the best we could do for this patient. What do we do next? So enter endpoint management. So in this particular case, we did a single treatment in both eyes of subthreshold laser or endpoint management treatment. And you can see the dramatic improvement in the macular edema. It's not 100% gone, but this is one treatment. And so his vision went from 20/200 and 20/80 to 20/40 and 20/50. So he's starting to get his license back. He's getting his life back. Lifestyle's improving. The eye doesn't look as bad anymore. He's seeing better. And if you can appreciate, obviously, the Triton does a beautiful job of giving us vitreous and retinal detail. You can see that he's got, obviously, a lot of cholesterol within the retina. The goal with the endpoint management laser system is not to get rid of cholesterol, per se, that his body has to deal with. But getting rid of the fluid and getting this improvement is something he wasn't able to get done with even 10 injections of anti-VEGF therapy. So these are the parameters that I use, actually. So we use the Arius and Trellis lens. Traditionally, use a 200 micron spot size. And as you're in the early phases of adopting this technology in your practice, you'll have to find the right power titration that works best for you. And unlike traditional laser, obviously, we sort of knee-jerk some settings, we really need to customize this power titration to the patient, and that's really where the endpoint management system shines. We have that option of being able to find the right power for the patient based on the pigmentation of the retina. So where else is this useful? I mean, I find in addition to using it in vascular conditions like diabetic macular edema and retinal vein occlusions that have undergone lots of anti-VEGF therapy and we've hit a ceiling, one area that is like a great place to use it is in central serous retinopathy. And so this is one of those less common conditions, but one of those conditions where we have not much to offer the patient. There's no anti-VEGF for this condition. These patients used to get PDT laser, which is becoming much more difficult to access in most countries around the world. So endpoint management and subthreshold laser is a great option. This patient came in with blurry vision, 20/63 in the right eye, 20/20 in the left eye. And you can see this round circular area of subretinal fluid. These images, again, we're taking from the Topcon Triton in our office. And again, as a multifunctional device, giving us the full perspective. Very quickly, getting color photograph, infrared, OCT, very, very fast. So here's his OCT from the Triton. You can see a nice pocket of subretinal fluid. The vision is down. Now, we all know traditionally we'd sort of wait about 90 days to see if the fluid resolves, but in his case, it was not resolving. And this is not a VEGF-driven disease. So what do? So we did an OCT angiogram to make sure, again, we're not missing some sort of choroidal neovascular process. You can see the OCTA images here for the vitreous, superficial, deep, and choriocapillaris areas. No CNVM, straightforward, run-of-the-mill CSR. So we decided that we were going to counsel this patient that we should do a round of subthreshold laser with the endpoint system. And we can see here, right after a month, his fluid is gone, okay? The retinal architecture looks pretty good. And what I've seen with some of these patients is that the photoreceptor zone and the RPE often are left untouched. And in some cases where there is a slight disturbance, you will start to see an improvement and a reconstitution as soon as 30 days. So my traditional approach with patients that I'm treating with endpoint management is to give them a round of treatment and then see them anywhere between 6 to 8 weeks following treatment to see how they're doing. Oftentimes, if there's any need for retreatment, I can retreat them at the 2-month mark without any question. So this patient's vision went again from 20/80 to 20/32 in the right eye, back to his normal function, happier, and he remained this way throughout the rest of his course. So again, back to the settings. I mean, again, we just tend to titrate these based on the pigmentation of the fundus. And the beauty of the Pascal, in addition to being a great PRP and traditional photocoagulation device, is that we can really titrate the power and see it in real time what the impact is going to be. So here's another example. It's a 48-year-old female that came in with blurry vision in her left eye, 20/20 in the right eye, 20/80 in the left eye. You can see her autofluorescence image there, which shows a bright white area of hyper-autofluorescence representing subretinal fluid, and the corresponding Triton OCT image for the left eye. So you can see, obviously, this patient has subretinal fluid, and she actually was having in vitro fertilization and was pregnant, and we know pregnancy is a risk factor for developing central serous retinopathy in women. And so that was the issue with this particular patient. We're not going to take her off course with her pregnancy, but we can't inject this patient with medications if she was a VEGF-mediated disease state, and she's not, fortunately. So having a laser is a least invasive option for a situation like this. So she also went through and had subthreshold laser given and went back to 20/20 with resolution of the subretinal fluid. So, what we see in the space of laser is that while our indications have shrunk down in terms of competing with VEGF, they're not zero. And when we're going to give laser now, we don't want to be doing focal burns where we actually damage tissue in order to resolve fluid. We want to stimulate healing through this subthreshold process and actually recover and bring vision back. Here's another final, I think, example here of a 53-year-old male with blurry vision, 20/80 in the right, 20/20 in the left. Similar scenario. This is the autofluorescence images that are coming off the Triton with the spade filters. You can definitely see this distortion here in the center, which represents subretinal fluid. Similarly, we actually like to use on-phos feature of the device also to show us the extent of the problem, rather than just looking at a single slice of the OCT. And you can see here this patient has subretinal fluid, obviously, and a large sort of thumbprint in the retina. The patient actually came in complaining, I see like a thumbprint in my vision. And when you look at the on-phos image, you can appreciate that it kind of does look like a thumbprint. So here's this patient after treatment with endpoint management. You know, again, titrating and customizing the settings to ensure that we're not damaging tissue, but stimulating healing. The OCT is improved, the vision improved. This large area where the patient had previous fluid can take a lot longer than a month in order for it to sort of settle down as the course of the anatomy starts to reconstitute. So, you know, a nice example of how to use multimodality imaging to evaluate the improvement in response to subthreshold laser. So that, I'll open it up to questions and go from there. Thank you.